podcast where we talk to smart people, but not necessarily done by smart people?
That is an awesome question.
This one goes down probably on one of my top 5.
Hey, I like nutrition. I like to eat food.
This is the coolest thing ever. We're going to do this forever.
I wish I paid more attention in that class.
You know, I'm going to be honest, I don't understand that. As a man, I don't get it.
Welcome to smartpeoplepodcast.com.
Hello and welcome to Smart People Podcast, conversations that satisfy your curious mind. I am John Rojas. I hope you guys had a great holiday season and are looking forward to a fantastic 2015. I know that today I sat and watched the final game of the Washington Redskins season. One of the things that struck me about this football game is just how much impact there is as these grown, humongous men just bash each other over and over, and specifically to the head. This week, we are talking about concussions, and we are speaking with a leader in her field, Mary Lee Esty. Mary Lee is one of the foremost theorists and scholars in the field of neurotherapy. She is also a senior fellow in Biofeedback and Neurofeedback. She's been doing research around TBI, which is traumatic brain injury, and this research began with an NIH-funded study, which was published in the Journal of Head Trauma Rehabilitation, and she did a follow-up study with Iraq and Afghanistan veterans in the Journal of Neuropsychiatry and Clinical Neurosciences. Mary Lee, along with C.M. Shiflett, are the authors of a book titled Conquering Concussion, where they talk about healing TBI symptoms with neurofeedback and without drugs. It's a super interesting read, and especially with everything that's going on today in the NFL and past NFL players who have been dealing with these brain injuries. It seems like it's now at the forefront of our discussions, and it's definitely worth the time to learn more about the subject. Please enjoy this interview with Mary Lee Esty.
Mary Lee, thank you so much for being on the show. Really appreciate it. I got a chance to read your book in advance. I appreciate you sending that to me. And the book is called Conquering Concussion. And I think it's such an interesting time for so many reasons. And you cover those in the book. The one that really has pushed concussions to the forefront of the news is obviously the NFL. And I was wondering, have you seen a big increase in people wanting to learn more about head injuries because of what's going on in sports?
Sports, yes. Personally, in our practice here in Bethesda, it's been more, first really was the head injuries from combat in Iraq and Afghanistan. And I am still providing treatment to Iraq, Afghanistan, and other veterans who've had concussions and exposed to blast injuries. And I think that has certainly been kind of synergistic with researchers learning more about head injury because they were forced to, with the hundreds of thousands of our veterans coming back with these injuries that are invisible, as most of the sports injuries are. As we watch football players, I think of them as gladiators. We just don't see the blood in the lions. But being an invisible injury creates so very, very many problems. As you've read, I'm sure, in the newspaper and magazines, it's, so-and-so was told just to take time and it'll pass. Well, for some people, the major symptoms, the headache and the fatigue may fade, and if they're really lucky, they don't notice anything anymore. But that doesn't happen to most people. And we also have what are called subconcussions, which are the little hits that probably occur more on the sports arenas than the ones that really look like a hit. So people look okay. And if you look okay, it's really hard to make the case that, I've got a problem. So many people have told me, in fact, even a relative of mine was in a fairly bad motor vehicle accident, and they find that they don't want to tell people that they can't remember what they were just told, how bad they feel, how confused they are. And this person, in fact, after one neurofeedback treatment, was amazed. About an hour later, she turned to her husband and said, "I know what day it is."
Wow.
And she hadn't been willing to tell anybody because she thought she was going crazy. And if you look all right, we've actually had physicians tell people who've been diagnosed medically with concussion or the post-concussion syndrome, say, well, if you just get a job or get a hobby, maybe you wouldn't think about it so much. Well, you can't get a job if you can't remember what you just read, or it takes you 3 times as long to write a simple letter or produce a document that you used to be able to do, boom, 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 like that. So that's sort of the immediate for someone who's been functioning pretty much okay. They have an accident, they get hit, they fall down the stairs, they fall in the bathtub, who knows? Or, in soccer or baseball or mostly football or ice hockey. And then they just can't do that so well anymore. Then you have the people who've had some level of those cognitive and fatigue and maybe headache symptoms most of their lives. Well, nobody made the connection with, and these literally happened just this week. We had someone who, at just a few months old, was accidentally pushed off of a table, landing on the head. These injuries before age 5, and the head of pediatric neurology at Hopkins, John Freeman, I've heard him say that when a child is brought to them with the question of, how come we have a learning problem, or, what's going on here? And he says, we know that we have to ask a lot of questions about what happened, the seemingly not too traumatic injuries, falling down the stairs or whatever, before age 5, because the brain is so very, very fragile in all those developmental stages. And it's quite interesting that if you look at the official diagnostic manual under post-concussion and post-concussion syndrome and ADD, ADHD, the overlap of the symptoms, the behaviors that will constitute those official diagnoses are almost identical. They're not exactly, but almost.
That's absolutely amazing. And, can you go into a little bit of detail about post-concussion syndrome? Because just the other day I was watching a documentary. I had never heard of post-concussion syndrome. And
people talk about concussion.
Right.
But the syndrome, the official diagnosis cannot be made unless the symptoms persist for 3 months after an incident.
I mean, 3 months, to me, that blows my mind because...
That's a long time.
That is a long time to experience something. And, I mean, correct me if I'm wrong, but one of the guys that was talking about it said that he heard a ringing in his ear for months.
Oh, yes.
Just
sometimes
things like
that doesn't go away. It depends on the physical damage inside the ear.
Yeah, and to me, that sounds like absolute torture. And to only be able to diagnose it 3 months after experiencing these symptoms, I mean, these people just seem like they're going through hell.
And they are. They really are.
Yeah,
it becomes I guess living hell is an overused term, but I am in awe of the people who come to us for help. And we offer all kinds of biofeedback here, so we can treat an awful lot of things. But getting well really requires a team. And part of what we talk about in the book is how do you put this team together depending on your symptoms. So it is tough. Right at first, the most common things are headache, fatigue. Remember, after the common things after you've had a concussion or your child's had a concussion, they say, don't let them go to sleep, right? You got to keep them awake. You get sleepy. Then there can also be nausea if it's, it's an impact that's got some real power to it. There may be some vision and dizziness problems, nausea, vomiting. That's absolutely clear-cut concussion. The subconcussion term is now being used by more professionals in head injury as a description of the little dings. The players collide on the field. They're a little bit dingy for a few minutes, and then they seem to be okay. But the effects of those seemingly mild experiences become summative. They add up. You may not notice any particular change, but over time, there can be a gradual change in cognitive function and emotional function, because becoming volatile, more irritable, more easily incredibly agitated to the point of violence even, is one of the longer-term outcomes of multiple concussions. And so you have these immediate things. So that shows up in school. I think it was Purdue University did a lovely 2-year study of 2 high school football teams in which they measured the number. They had accelerometers in the helmets, and they did a lot of preseason and postseason. They did MRIs, pre and post both seasons, and a lot of educational and neurological testing, neuropsych testing, I believe. What they found, just not to take too much time, was that even in the boys who had not had what they would call true, absolutely uncontested concussion, there were all these little hits that add up. And so over time, their way of coping and learning changed, but so gradual that they didn't notice. They would not have said they were changing. For those who really had obvious, non-contested diagnostic concussions, there was big change. And of course, now with all the imaging, it's getting easier to tell some of these things. Although imaging is not really an answer, an MRI can come out normal even in people who have major hits and major deficits. But there are advances all the time. Diffuse tensor imaging is a very special one that can help. But really, you don't need all that. You can track your symptoms, compare whatever was going on, the way you used to behave and function on your job, whether it's at school, at home, socially. But what we found in the veterans, who are kind of a microcosm, really, is a wide range of problems. So sleep becomes a problem. People who didn't have a problem sleeping before, now they have trouble going to sleep. They may have trouble staying asleep. And even if they get to sleep, when they wake up, they don't have energy. It's not a restorative sleep. And when you can't sleep, boy, everything becomes more difficult. They start having the memory problems. They start losing things. They find they can't remember names. I had a guy in here today who was saying, I just don't get it. He had a bad car accident. It was a bad wreck, a drunk driver. And at a meeting, dealing with some new people in this team, and could remember the names of the people that had been, part of this project prior to his accident, but not the new people. He could describe what they did, what they were supposed to do, and what they looked like, but can't remember names. So sometimes, people go to the doctor and say, what's happening to me? And I actually had a 30-some-year-old woman who had several concussions be told, oh, well, you're just getting older. Well, I'm sorry, you're in your 30s and you can't remember names now because you're getting older? If so, we're all in a lot of trouble. Reactivity, becoming easily irritated, and sometimes to the point of really people starting to walk on eggshells. And think of how many of our sports figures get into trouble, get into fights. Sometimes they're self-medicating for the pain. Oh, and don't forget pain. Pain can go with this. Not only physical pain, but headache is so common. And chronic headache is really, really just legion in this population. And there are a lot of reasons for that, which we don't have time to go into. Their whole attitude toward life changes. Becoming pessimistic, dour, somebody that many people just lose hope. They feel like they'll never become who they were. They don't know who they are anymore. Mood swings, up and down, or just down most of the time. And at its worst, suicidal. Of course, with our veterans, because of the horror of their experiences, magnified by a brain that's been exposed to blasts or blood injury, is just a really terrible combination. So it's not a pretty scene. It's especially difficult then when people look okay. So we're back to the invisible injury. You look okay, so just get over it.
Well, you mentioned that it can be the blast or the bleed, and that was one of the things I wanted to ask is because the subtitle of the book is Healing Traumatic Brain Injuries with Neurofeedback and Without Drugs. So there's two parts of this, but the one being, what is the definition of a traumatic brain injury? I mean, from the outsider's perspective, we think of a concussion, just you get hit in the head really hard. I don't know much beyond that.
Yeah.
So I was kind of hoping you could, let us know what is exactly going on.
That's an incredible question, and one we struggled with from the beginning. This book started out not to be a book. It's a brochure on steroids. What I asked Carol Shiflett to do, because she's really the writer, was if she would do a brochure that I could give my concussion and head injury clients, because they had so many questions. And as we got into this, and I have a lot of cases in here, the actual case histories of military folks as well as children and civilian adults, there are so many aspects to this. But the basic question we struggled with in the beginning was, and I think this is a problem for the whole field, is where does concussion, if you have a continuum, you get whacked on the head, okay, you're diagnosed with a concussion. At what point does it become a traumatic brain injury? There's really no clear-cut thing there, and this has a lot of implications. Language is important. Words and names really mean something, because most people think, oh, concussion, I just had a concussion, no big deal. And I've learned over the years, if I would say the word traumatic brain injury, people, oh, I couldn't have had a traumatic brain injury, could I? There's such a continuum. There's no one hit is exactly like another hit. So we think of traumatic brain injury somehow, maybe if somebody doesn't look quite right, then maybe you'd call that a traumatic brain injury. So I can't answer that question. I hope someday somebody can figure out a way to make the language better. So they talk now about mild traumatic brain injury. That doesn't sound so bad, right? Except it says traumatic brain injury. But a mild traumatic brain injury is not mild. It is totally life-changing. It's just to distinguish, historically, it's to use that term to distinguish it from something where somebody's in a coma for a long time or has such obvious physical speech, vision, maybe because of the injury, the whole face looks different. You can tell that something happened to this person, as opposed to the really severe one where, there's no question that there are so many deficits that, maybe they can't walk anymore or something that's incredibly obvious. But the beginnings from first little dingy whack on the head to someone who's maybe amnestic for a little bit, but doesn't really quite remember what happened in the last 5 minutes or so, but hasn't been unconscious. That's a very gray area. There's some very amusing stories, actually. Many, many people that we've seen come in and say, well, I wasn't unconscious very long. Do you think I had a concussion? And, the more or less official definition is if you are unconscious for even a second, that's a grade 3 concussion. So a grade 1 is just being, kind of perturbed for maybe 5 minutes or so, and then you kind of feel okay. Grade 2 lasts longer, maybe 15 seconds, and you don't recover quite as fast. But an amusing story recently was a fellow who became very depressed, and turned out that he'd had a few concussions. But then, sometime shortly, I don't remember now how long, maybe a few months before this severe depression set in, he said, oh yeah, I was in that car wreck, but he was driving out in the country, he was alone, and when he woke up, he'd wrapped the car or run into a telephone pole or a tree or something. And he said, but I couldn't have been unconscious very long because when I woke up, the police and the ambulance were there. Well, first of all, he was out in the country. There wasn't much traffic. But, if you're unconscious, you're not there. You don't know. You can't really make a judgment about this, which is why it's rather darkly, sadly amusing that sports figures will take a bad hit, and the football players, write about this. That, when they went back on the field, they had no idea what they were supposed to do or what was happening, and later have no memory of it at all. Mm-hmm. And they're just told, they ask them a few questions on the sideline, and there's some rather amusing anecdotes about that in the book, and they don't remember even being asked. Fred Smoot of the Redskins actually wrote about, this was a Washington Post article, very interesting article, about having taken a hit and being shaken up. And he said something like, I was on the field and just hoping that nobody would throw the ball in my direction because I didn't know what was going on. And when you think of the language, I really can't watch football games anymore because I just know what's happening.
Yeah.
But the language of the announcers, he's tough, he can take this, he'll get back up. But there's some really awful statistics that have just come out about the chronic traumatic encephalopathy in NFL players. And I just got this a few days ago, that the numbers now of the group that is studying the brains of the football players who died to see if they have chronic traumatic encephalopathy. They have 74 brains in hand, not yet examined. 55 have been examined, and 54 of them had chronic traumatic encephalopathy.
Wow.
Which it's different from, but it's like just horrible Alzheimer's. And a psychiatrist I know emailed me last week and said, I don't know where he heard or read this, that there are fewer high school players showing up for football.
I wanted to touch base on that a little bit because I'm completely in the dark with this subject. I do not know enough. And I didn't play football, which now, knock on wood, I'm glad that I didn't as a kid. But are we making bigger strides in the treatment of this or the prevention of this? I mean, are we going to be able to prevent it? Because football probably will not go away.
Oh,
and,
no.
No,
there'll always be people who want to do this.
Right. They make too much money.
And that's a choice.
Right. It's absolutely a choice. But do you think that we'll be able to make advancements in technology with helmets and other things? Who knows if airbag deployed helmets or something along those lines?
That's a great question. There's a fantastic guy at the University of North Dakota, Dr. Jaziski, who is a specialist in biomechanical engineering and in helmets. Anytime, no matter what you're doing, if you're walking downstairs, a concussion depends upon acceleration and sudden deceleration. Whether you fall or you get hit by something, the brain is going to be tossed around inside the skull because it floats. And he designs ejection seats. When you can imagine the acceleration, deceleration of a pilot being thrown out of the plane.
Sure.
The seat, I didn't know this, has to fit that body almost perfectly to be as protective as possible. But they're still suddenly going from, a certain speed to suddenly a huge speed. So the brain is still going to bounce. He says it is impossible to design a helmet that will prevent concussion. The closest would be if you had something that held the head and neck absolutely rigid and came down past the shoulders so that the head can't bounce back and forth on the neck, because the neck really isn't very relatively strong. So helmets will help prevent skull fracture, but it just doesn't seem to be possible to design a helmet that's fully protective. It's better than nothing. And I was just told by a lacrosse player that the girls who play lacrosse don't wear helmets. They should. That at least will help prevent, some of the more injurious things like a fracture. But prevention is really, really tough. So I urge parents who are deciding, and should be the ones deciding about what sports their kids play, to really look carefully at whatever teams they're going to be on, what kind of pre-season measures are they doing, what are their rules for taking somebody off the field or the arena, whatever. A very, very fine, probably college-bound lacrosse player just told me that she was out with a concussion on the sidelines, and they could actually hear two girls' heads hitting together. And the coach, remember, the coach's jobs depend on having their best players on the field, right? No matter what the sport. The coach turned and said, "I didn't hear that, did you?"
Wow.
It's awful.
There's so many aspects to this. There's the physical aspect. The one sport that has taken this incredibly seriously, to their credit, is car racing, the racing business. They have a system called HANS. It's head and neck something, HANS. And we have a picture of it in the book, so that the head and the neck are really fastened with comfort to the seat. So they're not going to get the whiplash injuries. Whiplash injuries are, even at slow speed, are very serious things because the neck is so very vulnerable. And the head just bounces back and forth like a bobblehead. As Carol described it, it's not that your head got whipped, it's that you got hit in the back of the head with the headrest. We don't tend to think of it that way. But, the one way we could prevent everything would be to live in a zero-gravity environment.
Live in a bubble.
Well, it would be a very special bubble. Maybe on Mars or the Moon. The Moon would be great.
The other thing that you are an expert on, and how you handle these TBIs and everything, is through this neurofeedback, which I had no idea what that was. So I'm sure a lot of people out there don't know. Could you kind of tell us, A, what it is, and B, how you use it?
Sure. Neurofeedback is just a kind of biofeedback, and biofeedback is any technology that gives us information about what's going on inside our body in a way that we can understand and learn to control. So just to show how far we've come in the last 50 years, just last year, the American Academy of Pediatrics, for the first time, lists for attention. They have what they call their evidence-based child and adolescent psychosocial interventions. These are recommendations to pediatricians for certain kinds of problems. So under the category attention and hyperactivity behaviors, they are listing biofeedback as a level 1 intervention that pediatricians can turn to and recommend to parents. The biofeedback they talk about, all of the research they cite, is neurofeedback. So biofeedback is generally thought of as information you get from below the neck or below the jaw, let's say, below the skull. Some kind of information from the body that's displayed to you in a way that a biofeedback therapist then coaches an individual to learn how to control their blood pressure, for example, blood flow, to reduce pain, to reduce anxiety. So biofeedback above the neck is neurofeedback. So it's neurological information. It's using computers, which have made this possible, to display what's going on in the brain in some way that we can understand. So the standard neurofeedback, which is very effective, has a lot of research behind it and is growing, and some insurance companies are now paying for this for certain kinds of issues. So the American Academy of Pediatrics is a good resource now for supporting getting neurofeedback for your child who may have attention problems, be diagnosed with ADD, ADHD. So watching a screen that is displaying something about that person's EEG, or brainwave activity, gives information about some kind of imbalance in the way the brain is firing. When people are symptomatic in some way, and it doesn't really matter what it is, whether it's cognitive, emotional, reactivity, pain, there will be an imbalance in the way the brain is producing energy. Where those imbalances occur in the brain are very important, and neurofeedback now, with this wonderful computer technology, can display what's going on in some way on a screen. So then, as you watch that screen, you get some kind of information back about whether your brain is nicely balanced or becoming more balanced, and you gradually learn, maybe it's through playing a game and getting points if you are making your brain fire in a more productive way. A common feedback now is the person can choose to watch a movie. The therapist is looking at a different screen. They're looking at what the brain's really doing. But the person watching the movie, they can pick a movie they like, they watch it, and as long as they're changing just gradually by concentration, how that brain is firing, their own brain, the movie will keep playing. If they start spacing out, it stops. Well, you want to watch the movie, right? So you come back to it. The kind of neurofeedback that I'm doing and other folks are doing is called a passive kind of biofeedback. I've been doing this particular kind for almost 20 years now, and I've got NIH-funded research for TBI, traumatic brain injury, or concussion, and more recently a study with the Iraq-Afghanistan veterans who, many of them pretty seriously wounded and very, very, the PTSD was a big issue with them. We had several who had attempted suicide, and we were doing a kind of feedback where the brain is learning passively. The computer's reading the brain waves and sending back a very small signal to the brain that kind of tickles it to change the way it's firing. There are several of these stimulation type systems out there now, and it can be very effective very quickly, and it's working quite well for our current veterans. So there's much more interest in this. And for some issues, we make a map of brainwave activity, which is just a chart showing whether there is an imbalance in the way this person's brain is firing that's consistent with their symptoms, and it acts as a guide as to whether this is someone who should be treated or perhaps not. So in both of them, the brain is learning. And sometimes combining the two therapies has been a more efficient way of treating. But you need an experienced clinician who's familiar with their equipment and how to use it. But more and more for traumatic brain injury, in fact, there's a quote from this guy's a psychiatrist at Columbia College of Physicians and Surgeons in New York, who writes, in cases of TBI or concussion, neurofeedback is probably better than any medication or supplement. And even in the Journal of Neuropsychiatry and Clinical Neurosciences in the last year, some researchers at the Defense and Veterans Brain Injury Center have written that there is no medication to treat TBI. There still isn't anything. But, the military health folks are really, really trying to help, and so medications, as any mental health or health provider is, are throwing various medications at symptoms,
Right.
which can help people keep going.
Yeah, deal with the symptom. Yeah.
But it doesn't change the way the brain's firing. And,
Right.
there are organizations out there where you can find providers. One is AAPB, aapeterboy.org. It's the American Association of Psychophysiology and Biofeedback. And another one is ISNR, the International Society for, I think it's Neurofeedback and Research. .org, so isnr.org, and they list certified providers. Oh, another one is BCIA, that's the certification organization. So anyone who's BCIA certified has been trained and met certain qualifications. But, I was appalled recently to see that the military, I forget who was making this recommendation, was going to be looking into, and this is, I think, with funding from President Obama's initiative, Brain Initiative, into ways to transplant things in the brain so that it would help, re-record or somehow plant memories back in people who had lost their memories. And I was just appalled.
I think I've seen a movie about that somewhere.
It's like Terminator 2.
Yeah, Strangelove. I don't know. There are easier ways. Surgery for many things can be wonderful, but kind of try the non-invasive first, maybe.
Sure.
Yeah, but that's what we do in the Western Hemisphere. We just say, "Oh, can we stick a knife in it and patch them up? Let's do it."
Yeah, and make it go away.
Yeah.
So. Start simple.
Yeah, it's really so surprising that this all took so long to come to the forefront because, like we said at the beginning of this, the brain is such a complex object, and we're just now starting to scratch the surface on how complicated it is and how important it is and how we need to take care of our veterans and to the extent like our athletes as well, but mainly our veterans. It kind of blows my mind that it's taken so long.
Well, part of it was needing technology.
Right. Yeah.
The appropriate technology. I have some beautiful slides that show the Menninger Clinic in Topeka, Kansas. The psychophysiological lab there was the real center for doing research on whether you could use information from your body to treat various symptoms. They started with headache and then blood pressure. It was very successful. But the machines were enormous. One of them is taller than a man, an ordinary man, probably 6 or more feet tall, and 2 or 3 feet wide, and who knows how deep. And now you can do all of that in an app on your iPhone or your Droid.
That's awesome.
So when I went out there in the late 80s for training, they had a device that was about the size of remember what a typewriter looked like? About like a typewriter. You don't see those. Those are antiques now. And now with, a simple laptop, you can do EEG biofeedback. You can do amazing psychophysiological biofeedback, which we find in sometimes, it's called heart rate variability. Sometimes 4 or 5 sessions, people who have lifelong panic attacks can just learn to get rid of them. So the technology was there. Just when you think of the incredible number of processes that are going on inside our bodies every second, you need a huge technology to just somehow sort those out and be able to see them. When you can see them, you can, it's pretty amazing, learn to change the way your heart and your lungs work together.
It is pretty incredible, but it makes sense. The most complicated machine ever being us, so we need almost equally as complicated machines to figure us out.
And we're just scratching the surface on the brain. My colleagues, all the neurofeedback people, are just kind of in awe of what is possible for some people. Not everyone gets helped, but boy, I think the vast majority do. And there's no way that anyone has, the answer now. But we have to keep learning. We have to do research.
Absolutely.
And show that this can work, which is why I'm doing this research, and the veterans are loving it.
Yeah, and in the book, obviously, you cover a lot of this stuff. It's really great for anyone interested in not just the traumatic brain injuries, but just the understanding ourselves, and through this lens is really interesting.
Yeah, I hope understanding and being kinder to ourselves and kinder to the people who are struggling. It is the lack of understanding that has bothered me the most.
Right.
To have a physician just say these, to me, outrageous things. But it's because I think the physicians don't fully understand. Mm-hmm. There's a wonderful neurologist who's one of the reviewers of the book who tells some wonderful stories about this kind of thing, of people being sent home who should not be sent home. Even he had some stories about Vietnam veterans there. So our hope is, and Carol, I think, has done a wonderful job in telling stories of real people. We don't have any made-up stories in this book. They're all real people. We've hidden their identities. But when you hear their struggles with their words, I don't see how anybody can help not being touched by this and beginning to have more empathy for people who look okay, but they're not going to tell you how much they hurt. And they're certainly, but ask questions.
Well, and for our listeners out there, what was the name of the website that you guys have up for the book?
Thank you. ConqueringConcussion.net.
Okay, great. And so they can go on there and check out, learn a little bit more, and also sign up, right?
Yeah, they can give information. So we think we'll be out pretty soon.
Awesome.
And we don't have an exact date, but it's at the printer. So I think this baby's going to be born.
About time, right?
Well, yeah, I think so.
Yeah.
Although it's been a wonderful adventure. I have learned so much.
I'm sure.
And that's what's exciting is to learn something every day.
Absolutely. That's why we do the podcast.
Yeah, you guys do a great job.
Well, thank
really.
you. Well, thank you so much for your time and sharing it all with us. Really fantastic stuff and things that I think, as I mentioned, not just because of what's going on in sports, but all over the place, people are interested in. So,
most of these things occur at home, falling downstairs because you don't have a handrail, falling in a shower because you didn't put down some kind of mat that would give you some friction, or you've got loose rugs around. You run around in the socks and fall on a slippery floor. The danger doesn't always look dangerous. We take the things we are around every day for granted.
No,
gravity is all around us.
That's true. All right. Well, I think that about does it for us, and we really appreciate you being on the show.
Thanks so much. I enjoyed it.
Absolutely. All right. Have a great night.
Have a good night.
You too.
Welcome back. I hope you guys enjoyed that conversation with Mary Lee. Again, her book is titled Conquering Concussion, and you can pick that up on Amazon or your local bookstore. If you are going to shop on Amazon, don't forget to use our Amazon banner at smartpeoplepodcast.com or use our convenient link, smartpeoplepodcast.com/Amazon. Really hope you guys enjoyed the show today. If you did, please head over to iTunes or Stitcher and leave a review, rating, comment, all that good stuff over there. It means a lot to us when you take the time out of your day to do that. We've got a lot of really good shows coming up for 2015. We're really excited about that. If you guys ever want to reach out to the show, please email us at smartpeoplepodcast@gmail.com or shoot us a message on Twitter @smartpeoplepod. See you guys next week.